Second opinion really does help the clinical efficacy of our practice. As dentists, we are expected to provide this thorough diagnosis to patients, not just clinically, but looking at interpreting radiographs as well. And when we take these x-rays on patients and get them up on the screen, we are expected to interpret them really quickly and see every problem that's going on. Every dentist, however experienced they are, has probably missed something at some point. So second opinions are a really great way of, like literally as it says on that tin, that second opinion, to make sure we're not missing anything. So I'll show you how to use it in a bit, but you pop it up on the screen, you basically hover a mouse over the x-ray, which is really easy to use, and it will show all the different pathologies and the different problems that a patient has. So what I've really found that since we've introduced second opinion is that our case acceptance has really excelled in our practice, which has helped us grow as well. Now, when a patient comes to your practice, they do have to have an incredible amount of faith in what the dentist is saying, especially if it is a new dentist that they've never been to before. So when you propose a treatment plan to a patient and show them all the problems that they're having, they really do have to have this trust in you. So if you propose a plan and then also bring the x-rays onto the screen and have this AI technology which you can hover over, which shows the problems as well, it literally gives the patient that second opinion, which really makes them trust and believe what you're saying. When they see these things on the screen, they might think, hey, maybe I'll have that crown changed because it's got a poor margin. Actually, I can see that there is decay there that I need to have. And what I found is that these comprehensive full mouth treatments have really been accepted because patients can see gaps, they end up wanting implants. So it really does increase the quality of treatments that are going out to the patient as well. So one of the things that I really love about second opinion is how intuitive it is to get accepted into our patient workflow. So it's adapted so easily. So a patient will come in, I do I'll give them my usual chit chat for the patient, have a quick look around the mouth, decide what x-rays I'm going to get. At this point, I usually take my x-rays. That goes off with my nurse who processes them, and everything's digital now, so it comes back super quickly. I will do the rest of my intraoral examination, and by the time that I've actually finished my exam, I turn around and already on my screen, the x-rays have automatically been put into the second opinion database, and the AI technology has interpreted these x-rays straight away, so then I can just hover my mouse over the screen and it will actually show any pathologies, any bone loss, any caries, any infection, to help me come up with my diagnosis. So one of the questions that other dentists ask me is if it's worth investing in this new technology and how cost effective second opinion is in the practice. Now, I opened this squat practice about 18 months ago, and we have seen a huge growth in patient acceptance and patients coming through the doors. Now, what patients want in today's world is more of an experience-led dentistry. Technology has come along so quickly in today's world that patients will associate new technologies with a high quality treatment as well. So when people come through the door, they have all their treatments with us. When we show them this AI technology that we use in interpreting their x-rays, they're blown away by it. And what they do, they go out the door, they tell their friends, and their friends come through to have treatments as well. So it doesn't just help with almost a great marketing for the practice, but it's also helping with the case acceptance for patients. So patients end up having a lot more treatment, which is good for the patient because they're having high quality comprehensive care, but it's good for the practice in terms of revenue as well. So it's a extremely small investment for a large amount of return. It's a no-brainer really. One of the beauties about second opinion is how easy it is to actually pick up in practice. I'm a bit of a technophobe. I don't find it easy using computers, systems, that kind of thing. And one of my concerns was if we invest in this new AI technology, how are we going to incorporate it into the practice if I'm actually going to use it? Because when you have a large amount of associates working for you and you bring in a new system, you need it to be super easy to use because they're just not going to use it otherwise. So one of the things that I've been amazed by is, it's how it incorporates into our usual system. So I'll get an X-ray of my patient. It's still uploaded in the same way through the digital scanners. And all I need to do is log into the program, which you've got a username, which is super easy to do. And then already my X-rays are on the program. So I'll find my patient name. I just click on the patient. I can click down on the different X-rays that I've taken here. It usually loads up within a couple of seconds. And the AI technology has already worked out and highlighted different pathologies in the mouth that help me with my diagnosis. So what I will do is I will go to this little area, I'll put my mouse over it and it will show me, hey look, there's a notable margin here that maybe I need to be talking to the patient about. Hey, it looks like there could be a little bit of pathology, a little bit of caries there. It will show me different areas of bone loss. So it's just so easy to use. I can then bring this up on the screen, show the patient the problems and areas that we might need to consider treating on or keep an eye on for the future. So it's just so easy. So 100% I would be recommending this to other dentists who are interested in providing quality treatments to your patients and also growing your practice, which of course all dentists are going to want to do. It's such a easy decision when you look at the case acceptance that you get in your practice. As if you're an experienced dentist or if you're as a new grad as well, when you come into practice as a new graduate, everyone has this slight imposter syndrome where you're not 100% about the things that you are presenting to your patients because you're new at it. So having literally a second opinion where you propose your usual plans or you think about it in your head and you just hover a mouse and it actually confirms that, hey, I'm right about what I'm thinking here, that's going to help you. But also as someone who is very experienced as well, it's going to help you with cut your time interpreting these X-rays, and it also does show up the odd thing that I look at that think, hey, you know what, think I'd have missed that otherwise, or maybe it would have taken me a little bit more time to see it. So it just helps everyone. The other thing that I love about it is my practice growth. This as a squat practice, which we only opened 18 months ago, has grown at a rate that I'm really happy with, because patients are just so impressed with the investment of technology and incorporating this AI that it just really helps through recommendation and bringing patients through the doors.